No discussion of nutrition or physical activity would be complete without touching on biases and conflicts of interest in the research itself. All research, including nutrition and physical activity research, costs money. And if it's to be done well and in a reasonable number of people, it costs a lot of money. There are only a few groups that are willing and able to pay for such studies. These include governments, wealthier charities, and industry itself, mostly wealthier, larger industries involved in food in some way because they have an interest in food. Although the government agencies and charities certainly can and do have vested interests, I'll focus on industry and individuals in the following examples. Funding, which is absolutely necessary, can lead to financial conflicts of interest. A company may fund the research itself, partly or in its entirety, and or they may pay consulting fees or similar to one or more of the researchers. Or they may have a similar financial relationship with a peer reviewer of a study before it gets published. Peer reviewers, for the most part, determine if a study is published in a particular journal, so there's a degree of power there. And just to clarify, peer reviewers are selected based on expertise in a given area. They're certainly not selected because of any links to industry, but they are also not excluded because such ties exist, or when such ties exist. This isn't the case of intentional manipulation. It's simply that we all have a tendency to be more critical of something that appears to conflict with our own views and or our loyalties. If the study received the funding, this may have given the funder control over the design of the research. They may even have had some of their own staff working on it, and they may retain the right to not publish the study if the results are not to their liking. On a more basic level, the funders have a lot of control over what kind of study gets done. In other words, what research questions get answered. A company simply has to decide a certain research question is not in their interest to have answered, and therefore not fund it. Now you may quite reasonably counter that another company would just come along that may have an interest in that area. But this is often not going to be the case. Why? Well, for one, only a few corporations own the majority of food production. As you can see in this graphic from, I think, 2018 or 2017, 10 umbrella companies own the somewhat smaller companies that produce most of the processed food on supermarket shelves. If you were to look at agriculture or supermarket ownership, you'd also find that relatively few major players, the kind who can afford to fund research, actually own the bulk of that entire industry. Let's consider the macronutrient composition of processed foods for a moment. Sometime, I think it was in the 1970s, the first dietary guidelines came out in the USA. Around about that time, fat, especially saturated fat, but fat in general, fell out of favor. So a good portion of the food industry focused on making low fat and therefore often high sugar products. The industry at the time responded to the guidelines, although there is actually plenty of evidence that they tried to heavily and did heavily influence research that led to those guidelines. But nonetheless, after the guidelines were formed, the industry responded. However, now it's much easier and more lucrative for those industries to ensure that the guidelines do not change in any major way. That way, they can keep producing what they're producing. Reformulation actually takes a long time, and consider this is on a massive scale. I think Coca-Cola provides a great case study, although it's certainly not the only one, if we want to look at the influence of industry. Here are the top 13 beneficiaries in financial terms of Coca-Cola Company funding during the period of 2010 to 2015. So the Pennington Biomedical Research Center, that's well over $6.5 million. National Recreation and Park Association, well, not an obvious direct link to food. Another research foundation, again, we don't know what the research is in, but you can assume that it probably wasn't going to be research likely to be detrimental to Coca-Cola Company. Boys and Girls Clubs of America, Triple Play program, well, that's the hearts and minds of young people. The Healthy Weight Commitment Foundation. Got to wonder about that. Not sure what the Don't Quit Foundation is, but it got a lot of money. The American Academy of Family Physicians. Well, that is a little bit telling. Basically, that is GPs. Not in New Zealand, admittedly, but in the US. The American College of Cardiology. What a wonderful pairing. Sugared beverages and people focusing on heart health. Not quite sure what the Garfield Park Conservatory Alliance is. It's only here because it had to go in there as the next one down. But the American Academy of Pediatrics. So we've got the Boys and Girls Clubs of America, and we've got the American Academy of Pediatrics, and we've got the American Academy of Family Physicians. Also, the National Foundation for the Centre of Disease Control, National Parks, not so interested in that, and the Emory Global Diabetes Research Centre. And the list goes on. You can look at the top 50. Millions and millions of dollars have gone out in terms of funding. Now, the question is, why? And I'll leave you to ponder the likely answers, and I'm sure there's more than one, but I cannot bring myself to believe that it is entirely altruistic. Getting back to the researchers themselves for a moment, researchers and peer reviewers. And just to be clear, these are the same people. I, for example, do research that others then peer review if I want to get it published, or even sometimes before I want to get it published, before I even want to do it. People will be overseeing that and thinking about, is this ethical? Is this worth doing, and so on. So I act as a researcher, but I also act as a peer reviewer for others. It's usually anonymous, so please don't get the impression that this is a trade. I'll review you favorably, you review me favorably. We don't generally know who's doing the peer reviewing of our work, especially not after it's been done. The important thing here is to keep in mind researchers, scientists, doctors, they're just people. And like many people, some have strongly held beliefs, including clear prejudices that might motivate those researchers to design research or simply present their research in a way that supports their strongly held beliefs. For example, they may hold on to this idea that saturated fat is bad, and therefore emphasize research consistent with that view. We have plenty of psychology research telling us just how blind we can be to opposing views that don't suit us. Someone might be staunchly vegan on ethical grounds, or maybe on other grounds. They believe in environmental grounds, for example. That is going to taint how they view research. It's going to, one, determine the kind of research they do, and that's fine. We want people to do research that they're passionate about. They're more likely to do a good job, even though, yes, some bias might creep in. But if they're a peer reviewer, for example, that can be a real problem because they have this very strong inherent bias. They may simply believe that a given dietary approach is unsustainable. I see this all the time in relation to ketogenic diets. Most dietary approaches are difficult for the majority of people to maintain, and sometimes it's not even necessary to maintain it long term. So judging every dietary approach by its sustainability over years and years doesn't actually make an awful lot of sense. Very low calorie diets have proven immensely useful for people trying to reverse their type 2 diabetes, for example. Yet they're inherently unsustainable, but they're meant to lead to weight reduction, and then the person is meant to go on something a little bit more moderated. But there are plenty of people in the nutrition world that simply are holding on to this idea of something isn't sustainable, even if there's contrary evidence. As long as the research participants frequently have difficulty, they will conclude that no one can do this if it suits their interests. So we have these industry influences, and charities have their own interests as well. Government can sometimes have a vested interest. No one is free of bias entirely, but we also have these sometimes strongly held personal views that often aren't on scientific grounds. So I'm not talking about someone simply being objective but critical, which is their job. I'm talking about someone who is fundamentally opposed to something on other than scientific grounds.